Welcome back to BRMC's Healthy Connections with our guest today, Lori King McCracken, who is the marketing coordinator for our First Step program, which is an alcohol and
pain
medication.
Stabilization.
I love it. Okay. We've been talking about that because it's Drug Awareness Month, and we wanted to make everybody aware of a lunch and learn that's going to be down at the Schliemann Center, April 17th, coming up pretty fast.
Next Tuesday.
Next Tuesday. Okay.
Just in case that date's not correct.
Yeah. Next Tuesday. No, that's the 17th.
Okay.
At noon, and the Schliemann Center, for anyone that might be new to the area, the hospital has 4 community houses. Directly across from the Klein Emergency Center entrance, there's a parking lot, and on the other side of the parking lot are regular homes, and those all belong to the hospital. We start with, and I'll go right down the list, the Pites Cancer Support House, the Rappel Diabetes Learning Center, the Maruck Family Center on Aging. Then we've got a couple of other houses that are there for different uses right now, and then we have the Schliemann Center. That's the last house on the block. So there's always parking, plenty of parking, and their number, if you want to go ahead and pre-register for the Lunch and Learn that Dr. Lincoln Godfrey will be giving about the First Step program and what it involves and what they're doing to help folks become, to get them off drugs, is 2345. 508-2345 is the number to re-register. It's okay, Lori.
So, no, that's a pretty easy number to remember.
Yeah,
I think I can remember that one.
5. We might want to go ahead and give those additional numbers at the front of the phone number, too. So what else is going on with First Step? How far do you travel? I know you go out, you do the external marketing for First Step, and where are you going?
Well, I've traveled in the rain.
Yeah.
So usually I typically, one at Ridge Jonesboro is about as far as I travel in that direction.
Okay.
The Hardy Highland, I'm going to Houston, Missouri next week to do an in-service at a clinic there, and that's a pretty good little distance.
It's important to meet with all these clinics, all these referring physicians, so that they know that we exist, and
we still are existing.
Yeah.
I'll travel anywhere.
Yeah.
If I get a referral, I will travel to make sure that doctor is thanked.
1-800 Lori travels. Yeah. So you're just
Arkansas, Missouri. Mm-hmm. It really is right now my territories.
And for those just joining us, Lori was sharing with us that you're starting to see now a lot of people coming in
from Oklahoma. And we are going to buy an Oklahoma map so we become more familiar. But we're seeing people from Oklahoma City, Stillwell, I think, is a town.
Mm-hmm. Sure. Oklahoma. I know where that is. That's not too far outside of Tulsa.
Okay.
Yeah, if I'm correct.
So we're getting people about 6 hours away that are making that drive.
Okay. And as you'd said earlier, there just aren't that many.
There really aren't that many. And with treatment facilities, there is such a risk. They want a patient when their client comes in for long-term treatment, they want to make sure that they are safe, they're medically stabilized, mm-hmm. because they do not have medical staff at these facilities. So if someone was, to start withdrawal symptoms, have a seizure, they can't do anything.
That's why First Step exists.
It's so
that's
important.
Why
yes.
That medical stabilization is then really you're getting the patient ready to go into, and
we're kind of getting them prepped
for a 30-day program that mm-hmm. in many cases, what you're saying is throughout the state of Arkansas and some of the other states, it's a 30-day, but it's primarily more maybe counseling,
one-on-one.
Mm-hmm. Okay.
And,
but not medical intervention.
There's most treatment facilities, because insurance doesn't cover it.
Yeah.
There's no medical staff there.
Yeah.
So they, First Step is able to get with those people, make sure they're medically managed, and then we can go to the next step to treatment.
Mm-hmm. How are you doing as far as the success rate? Have you got any stories you can share with us without mentioning any folks that?
We're actually working on that right now. We're going back in the last 4 years, calling people mm-hmm. to find out,
how they're doing.
Yeah. And honestly, it is. We don't have any numbers yet. It is surprising the people that are doing very well, who came into us, went through the service, went to treatment, mm-hmm. now doing outpatient, doing counseling. And you can always hear the spouse in the background yelling, "Thank you, you know, we're this many days," and he's quit smoking too. We have our friends who call us monthly to give us an update on their life, and it's very neat. And it's not just the older people; we're seeing younger people too.
Younger people coming in, and I love to hear that people are just absolutely saying, "I can do this."
And I guess this is kind of a success story. We did have a patient who further went on to treatment. He is a very intelligent man, educated, college educated. But this facility liked him so much and saw all of his talents that they are now wanting to find him to offer him a pretty big job.
Oh, wow.
I know. So I think that's
a huge success story.
I think so too.
Absolutely.
Yeah.
Because who better to talk to other people, other addicts, than a former addict?
Right.
To say, kind of a twofold reason, not only to empathize, but to also know when somebody's just not being, like, wait a minute, that's kind of a lot of baloney that you're sharing with me right now. You're responsible to go ahead and try and...
But this position that was offered it's a good job. I mean, it's good. Yeah. So, we were excited. We're very excited.
I would be
too. Haven't broke the news to him yet, but he's not from around here, so we're not like giving some big secret away.
Lori's very good about making sure everything is kept confidential. That's as we follow all HIPAA regulations at the hospital.
And anyone that calls, it is a confidential call.
Sure. So someone can just literally pick a family member with a concern, and I'm sure you've got lots of resources that you can share with them.
We do.
If maybe how to get the person
and sometimes
to come in.
We've kind of become a hotline to some, just calling to say, or just to ask local AA meetings, which we're more than happy to answer those questions.
Good for you. That's wonderful. I know you and Christy Stuffelbeam.
We do.
You run a great program. It's absolutely wonderful. One of these days we'll get Miss Christy in here.
I think we
She's a little camera shy, but we'll get her in here. So, but I mean, what you're doing is remarkable. It's wonderful. It's 4 years down the road, and look at the difference in the lives that you've made.
And we've learned a lot too.
What are some of the things you've learned?
Just different resources.
That you weren't even aware were here?
Didn't have a clue. And every day we find a new little hidden facility. You know of your big ones, but then there's always some little hidden ones. We have one right down the street. We had no idea. It's in Harriet, Arkansas.
Wow.
Yeah. And
How many beds? How many?
I'm not really sure how many beds, but it's like this little jewel. They have actually a physician that flies in from Dallas. But we have actually referred patients there. Patients doing good.
Excellent.
So we do try to accommodate, use our local resources if we can.
What have we got locally for people that they may not be aware of? Is there anything you can share that some resources that we have here?
Locally in the area, we have several counseling agencies. Then we have our local Narcotics Anonymous meetings, Alcoholics Anonymous meetings.
I know we've got those. We usually post all of those on our internet site.
And I think there's one at the hospital. Okay.
There's one that comes.
I'm not sure which
Alcohol Anonymous.
I'm not sure which date that is. We can find out if anyone has any questions. Just call our office and we can find out for them.
508-7590.
That's it.
On that one. I'll put that 508 in there this time. We're so used to just using the last four numbers. But yeah, I know that we always find room for different groups like this, support groups that are trying to better their lives.
In the lives of others, too.
And the lives of others as well. So, Lori, it's always so much fun to have you here on the show. You always, that beautiful smile, and you bring such great information to us. I'm so glad the program is going so well.
I am too. I feel like it is needed very much.
Yeah. Yeah, I bet there's more of a need than any of us probably realize. I know when Sheriff John Montgomery did his, you could drop off your old prescription.
Yes, at the fairgrounds.
At the fairgrounds they did, about a year or so ago? No questions asked, just drop them off. I think they were even surprised at the amount of prescription that were collected.
Yeah,
So.
and they're doing that annually, aren't they?
Yeah.
Okay.
Yeah, they're doing that annually, and boy, that's really that was an eye opener with talking.
Oh, it's a much needed service.
Yeah,
it is much needed.
Yeah.
We do take Medicaid, Medicare, insurance, as well as private pay.
Okay, Medicare, Medicaid, and you said the Sooner.
Sooner Care, which is Oklahoma
Care.
Medicare, and then we take Missouri Medicaid. So even if someone's from out of state and they have Medicaid, we'll verify that and make sure that we can accept it.
Yeah, because the entire program is all licensed with the state of Arkansas at the hospital.
Yes.
So, thank you so much for joining us again.
You.
We want to be sure, one last time here, Dr. Lincoln Godfrey he's the First Step Medical Director. He'll be sharing information about the program and answering questions about pain medications, drug and alcohol abuse, and addictions during a Lunch and Learn program set for noon, April 17 at the Schliemann Center. Cost is $7 if you're having lunch, but they need to have you pre-registered, so 508-2345. Give them a call, or if you want to talk to Lori or Christy at the First Step program directly, that number is 508-7590. And we want to thank you for joining us this afternoon. Lori, thank you.
Thank you.
Thank you, viewers, for joining us. We'll talk to you again real soon about what's going on, and join us again for BRMC's Healthy Connections.
Music.